Magnetic resonance imaging is an advanced diagnostic technique used in medicine. The examinations are performed using a magnetic resonance scanner. This imaging technique does not apply the potentially hazardous ionizing radiation. A very strong static magnetic field is produced in each magnetic resonance scanner. Due to this, patients must not enter a room with any items made of ferromagnetic metals or objects which can be demagnetized. These include watches and magnetic cards. For the same reason, the examination cannot be performed if the patient has any objects made of ferromagnetic metals in their body, such as screws, plates, clips, stents, prosthetics, or pacemakers. Before the examination, the patients must fill in a special form in which they exclude such elements in the body. During the procedure, the patient's body is exposed to the operation of a strong static magnetic field, as well as impulses of radio frequency electromagnetic waves. These induce the phenomenon of magnetic resonance, whereby hydrogen nuclei within the patient's body emit signals which are received and transformed into images. To have a magnetic resonance examination performed, a patient should present a referral issued by an authorized physician. During the examination, the patient is lying on a special table which is placed inside the scanner. The patient receives earplugs as a protection against the noise produced by the scanner. To make sure the examination is carried out correctly, the patient should follow the instructions of the personnel performing the exam. Most importantly, during the procedure, the patient should lie down, stay very still, and hold his or her breath when asked to do so. Obtained as a result of the examination, the cross-sectional images of the patient's body, or the so-called slices, correspond to the selected planes: transverse, sagittal, and coronal. The imaging data acquired this way may be used to create three-dimensional reconstructions. For some examinations, a contrast agent must be administered intravenously using an automatic syringe injector. In the case of an examination requiring a contrast agent, the patient must refrain from eating for at least a few hours before the procedure. They must also present valid results of a creatinine test. All the images from the magnetic resonance examination are transferred to a CD. A magnetic resonance examination is performed by a team consisting of a radiographer, a nurse, and a radiologist. The latter supervises the examination by specifying the method to be used and modifying the procedure as required by the situation. Radiologists always make the final decisions, so they must be present during the examination. Interpretation and reporting of the images are performed by a radiologist. The patient receives the report of the examination and the CD.